Occasionally on Out of Practice, we step outside our usual conversations to bring in guests who help us explore how the concepts we discuss play out in real veterinary careers. Today, Ginger sits down with emergency veterinarian and practice owner Dr. Ben Donati to talk about mentorship, leadership, and the relationships that shape professional growth. Let's get started. Hi, I'm Addie Reinhardt.
And I'm Ginger Templeton.
We're both vets who stepped out of full-time clinical practice, but we're still deeply rooted in the profession.
And this is Out of Practice, a podcast where we talk honestly about life in and out of vet med.
This podcast is brought to you by MentorVet.
Benjamin.
Yes, Ginger.
How are you?
I'm well. How are you?
Welcome to the podcast.
Thank you. It's exciting to be on one.
Should I not call you? You've heard of them.
Yes.
We established before recording you've never been on a podcast.
No. First time.
When you were a kid, did you record yourself?
Long time listener, first time caller.
That's a lot because we haven't been recording that long.
Yeah. When I was a kid, what?
Did you do record yourself?
Yeah, I had what was it called? The Talkman. You know the thing they have in Home Alone where he changes his voice?
Yes.
I had one of those and I lost it in a sandbox in my elementary school. And my parents, I used to have I don't even know what it would be called. I think it was potentially called a karaoke machine. It was like a boom box.
Yeah.
Probably 2.5 feet high. It was the size of an amplifier with a plug-in, aux cord with the metal graded microphone. And we used to record stories and songs and stuff for my grandparents. We would send them in the mail and then they would write us. My grandfather used to write stories for us and then they would record them and then send them back. So
that's
we come
lovely.
across them every now and then. Yeah.
So you've basically been on a podcast.
Yeah.
It's the same. Well, this is our little podcast. So Addie and I started this a couple months ago, and I reached out to Addie. So Addie is the founder and CEO at MentorVet, a veterinarian, of course. And you said you've not met her yet. Is that right?
No, but when you mentioned her name, I know I've come across it somewhere, and I think it's through reading about MentorVet. There was a grant through AVMA or some relationship.
Yes. So they had or have, and I don't want to misspeak, but a mentorship program through AVMA that MentorVet was essentially creating and implementing, available to the profession, among a lot of other programs, great programs. But our listeners don't know who you are yet, so we should probably tell them why I'm talking to this guy about the sandbox.
Yeah.
And your grandparents and MentorVet. So do you want to introduce yourself?
Sure. Yeah. I'm Ben Donati, VMD.
VMD. Guys, he's a Penn grad.
Proud Penway, V17. I'm glad that the recent Penn grads have taken hold of it. So class of 2017, I'm a small animal emergency vet. More recently, over the course of the last 4 to 5 years, have transitioned over into practice foundership, ownership, management, kind of all of the above. But sort of career pathway after vet school, did a sort of classic rotating internship at Veterinary Emergency and Referral Group, and then in Brooklyn, and then worked at a small animal specialty ER practice called North Star in New Jersey, and then did a little bit of traveling, some people call per diem, relief work while sort of setting this up. And when I say this, it is an emergency and specialty practice called Apex Vets in Silver Spring, Maryland, just outside DC. And we're entering just entered our third year.
Congratulations. That's tremendous.
Thank you.
When we launched this podcast, first I should say, I was no idea what we were getting into. I reached out to Addie saying, can I do something to help MentorVet? I was feeling kind of bummed about the world, feeling the need to volunteer, do something more, selfless than my day-to-day work. Sure. And she said, let's start a podcast. And one of my first suggestions was that we have people like you on who are not making the rounds. I feel like we hear the same voices amplified on a lot of veterinary podcasts, and they're great. They have really great information and things, but we don't necessarily hear from the doers who are out there, in clinic day to day.
Sure.
And the name of the podcast is Out of Practice because Addie and I are both in primarily non-clinical roles. She does still do some relief. And I think having somebody who has their finger on the pulse of what it really is like in clinic is important.
Sure. Yeah. And how long have you both been? I guess you said she's still sort of in it, but kind of similar timelines for the two of you.
Very different timelines. So I graduated in 2007. I was a prodigy. I was like 10 years old when I graduated.
Little baby Mozart.
That's right. And practiced for, I don't know, like 15-ish years. I owned a mobile GP for about 5 years and slowly started to tiptoe into consulting and coaching after doing some training at the University of Tennessee and then some pretty in-depth coach training outside of vet med. And I stayed in practice, really clung to staying in practice in some capacity for a long time because I noticed every time I worked a shift, if I was doing relief or was in the clinic where I, had been full-time previously, it informed my coaching and consulting in a way that, you just quickly would lose sight of, or I would quickly lose sight of when I wasn't. However, when I took the role at Moves, there's just no time. It really is truly full time. And I say I'm not a clinical, don't get me wrong, I will certainly do site visits and spend time with my specialists. But it's not, the same as running a practice, being on the clinic floor. I mean, you were seeing cases last night, right?
Yeah. So last night, we have a bit of an odd structure or formula currently. Most of my clinical time now is spent as an on-call overnight hospitalist, I guess you could call it. Sort of overnight case management for our sicker patients. So we are 7 days a week, nursing care 24/7, and emergency 7 days a week. But we have an ER doctor scheduled on the floor from 6 a.m. to the following 1 a.m. with the ER doors open from 7 a.m. to midnight. So we do have a 5-hour window where we potentially wouldn't have someone in the building where we stop. We have the 7-hour window where we stop seeing cases, but a slightly shorter window where there's no doctor in the building unless there needs to be. So that's kind of where I come in clinically is I'm on call, let's call it most minutes.
So great work-life balance.
Yeah. Yes, exactly. Work-life imbalance.
And this is where, I started thinking how you would be a great guest for the show. So there are a couple of things that come up when I think about you and what you're dealing with, choosing to do in the profession right now that are so relevant to what Addie and I think and talk about, and especially the mission of Mentor Vet. So 3 things, and we'll probably pick one to start with and then follow up. But the first thing you just said, and I was not planning to talk about this, am I the mentor or am I the mentee? And the premise that we live by at Mentor Vet is that at every stage of your career, you probably can be both. And there is also a great deal of value in peer mentorship when you're really just collaborating with somebody who is at a similar stage that you are, and you're sharing wisdom and support. And I don't think we think about peer mentorship in a formal way, but Addie opened my eyes to that concept that exists in the mentorship literature. And I just think finding people, whether it's a peer or somebody who's been there before, is so important. And you're a practice owner. Do you have a mentor?
Yeah. I mean, I have multiple, I guess. I would say first and foremost from a, purely business standpoint, my mentor would be my partner, my business partner, Stephanie. Stephanie's a now retired surgeon who owned practice with a couple of multiple locations in Texas. Over a different timeline than me and in a different way, transitioned from, clinical practice to management. She opened her practice coming out of residency, which is, slightly different than me as a non-specialist. But just sort of from a, mentorship standpoint, and it's interesting you say, the peer-to-peer mentor, because I would call her both. There's very often the case where I feel like I'm, where I know and feel like I'm getting the, sort of consulting from someone who has done it before, but she readily admits some of the things we're facing are different. It's a different time, it's a different geographic location. The, sort of the average practitioner is different in many ways. So I think that that's often where some of the peer-to-peer part comes in, and it's important to me to have really like a sounding board. And then, I think mentorship wise, mentors come in, all different shapes and sizes in terms of, to a lot of what you do, like coaching, and a lot of that is, seems to be transferable. It doesn't need to be like, that's just where like the vet is the widget, or the, the veterinary industry is just the widget. It's just a thing. But yeah, I guess that's sort of my take on mentorship. And I like that you said we can be both, and I would say we should be both.
I agree. And I think thinking of ourselves as mentors is often, there's a transformation that has to happen in the career, in the mind. Just like what you said, like, am I the mentor now? I think that teaching veterinarians early in the profession to start to look for opportunities to mentor and see themselves in that light can really help with positive influence across the profession.
Yeah. Do you think that people sort of naturally end up in that position? Because I hadn't really thought of that. Like, we don't learn so much. We don't really learn how to teach in vet school, whether it's medically or communication wise, business wise, life wise. Like, I feel like we get so wrapped up in student. Okay, now you have a degree, and that might mean you're still a student, internship, or you're a student because you enter a mentorship program. And I personally think we should be lifelong students. But do you think it's like a specific type of person who wants to kind of transition into
mentorship?
Well, yeah.
I don't think it has to be. I mean, I do take your point that there are probably people who are more interested in it and maybe more predisposed to be effective. But I also think that a lot like coaching, I was really surprised at how much I actually learned how to communicate in a different way when I went through coach training.
Mm-hmm.
And a large part of that was the program that I was in. Our faculty, they were almost entirely psychologists, so PhD psychologists, some clinical, some other areas of psychology. And they would observe two students coaching one another, and then they would pause and tell us what we should have literally said in a different way, what we should have noticed and acknowledged in the person's body language, like all sorts of feedback over and over and over again. And I think that I was a very different communicator when I went into that, even though I was somebody that most people would have said, oh, you could be a coach. Oh, you should be a mentor. Like all of that kind of type of personality was there, but the skills were completely different when I finished. And I think mentorship can be that way as well. I think people can learn some of those skills through formal programs or just through, kind of reading and self-awareness and that type of thing. So I think that if we teach by talking and sharing and normalizing like we're doing right now, earlier career vets to think of themselves as mentors and look for opportunities to mentor formally or informally, I think that probably puts it on radars for people that, wouldn't otherwise be there. And I will say, having taught mentors, worked with training mentors for Mentor Vet, I think that every individual needs a different type of mentor. So like there is somebody out there for you, right, as a mentee, and vice versa. Like even if your personality may be not what I needed a mentor, it might be what somebody else needs.
Right. Who do you think is best positioned to determine the person or type of person that someone should have as their coach or mentor, or, the push-pull kind of?
I love this question, and I don't think I've ever been asked it.
Oh.
And
Congrats to me.
Yeah, high five. You guys, he's going to take over my role. He's going to be the second host. Seriously, I think about coaching. Well, first, it's probably helpful to define what a coach is versus a mentor. I think a lot of people are calling themselves a coach. There are many grifter programs out there that are taking money. It is what it is, right? It's like the wellness grift. And so people are, paying large sums of money to quote unquote become a coach. And it's not a regulated term in the US. And it can mean any number of things. And I also think that there are people who are tiptoeing into inappropriate space, not fully trained on how to make a mental health referral, how to screen for somebody who needs professional mental health services, not a coach. So I think there's a lot of murkiness out there in the coaching world. However, a coach is a thought partner. Like at the end of the day, a coach is somebody who can typically relate it to your professional life or some specific finite, growth area that you're trying to achieve personally, talk with you and ask you questions and listen to you and catch things maybe that you're not noticing about yourself, reflect them back to you, and ultimately create a space where you arrive at ideas, decisions, plans. It's not somebody who's there giving you advice necessarily. There is, definitely a time and place where I will give advice and I will say, putting on my consultant hat right now, or let me tell you as a manager or as a CEO or as somebody who's gone through HR stuff. But if I'm giving advice, I really want to make sure I'm calling that out because that's not what I'm there to do when I'm working with a client. I'm really there for them to arrive at their wisdom that they possess, their knowledge of their circumstances that they need time to think through.
Right. So would you say a coach is more of a position of analysis than a mentor?
So I think that there can be analysis with coaching, but it is very much that thought partner. Maybe they're grabbing things that the person is saying and there's some analysis there, but they're not really sitting there analyzing the reality that the person is giving them and then arriving at some conclusion for that other person, for their client. They're really hopefully asking good thought-provoking questions so that the other person is arriving at their own analysis and taking the time for it. I mean, a lot of it, I think, too, is just creating space. A mentor, on the other hand, can do those things. They can operate as a coach. They can ask good questions. But I think there is this inherent, volunteerism in mentorship. Like if you really look at the literature, most of what has been written about mentorship and can defined as mentorship involves some level of a giving of their time and a giving of their expertise. And then outside of the peer-to-peer piece, there tends to be that assumption that the mentor has more experience within the field, within the area that the person is wanting mentorship in. And actually in coaching, that's not always true. Theoretically, a coach should be able to coach across all disciplines. Now, I coach veterinarians and usually, honestly, more like leaders within veterinary medicine because those people want to talk to me and they trust me, but it's not because I can coach them necessarily any better than I could coach a nurse or a CEO or a physician.
That's just who your group tends to be.
Yeah, because it makes sense to them.
Outside of it?
I have. I've coached outside of VetMed. It's actually quite a lot of fun.
Is it?
I really enjoy coaching people in leadership, especially if they are kind of in an entrepreneurial space. So, they're trying to manage, they're trying to lead, but they're really more like a visionary mindset. They're not really a manager. And one individual in particular that I worked with was in a kind of hospitality adjacent, nowhere close to VetMed.
Cool.
Thoroughly enjoyed working with this person, had a military background, had just an entirely different world experience than anything that I had had. And again, it was really about him tapping into his knowledge and his style and, problem solving together, but not me solving his problems or telling him what he should do.
Right. Interesting. How often do you feel like you end up sort of was the goal with that person to make him a manager, or was it and to get comfortable with it, or was it to release himself from maybe he felt that as an obligation or a challenge he needed to try to overcome, but then like was there, you kind of set out to like, I want to transition this to someone else so I can be in my natural space? Or was it, I want the challenge of becoming something I'm not?
Yeah, so stepping outside of that individual as an example, just to not get too in the weeds on a person, right, and their story. But I think in its best form, there is certainly never a goal from the coach's standpoint, right? Like if I come into coaching with a goal, that's not coaching, that's consulting. And that's probably even more like beyond consulting even, right? Like I think even a good consultant shouldn't really have a too overly prescriptive approach. Though I would imagine some consultants may disagree with that. But usually what happens when a client comes to me, they're dissatisfied. It's vague. And then we, week after week, kind of arrive at what are the problems. And so, for example, if somebody's not wanting to be a manager, not even maybe cut out in their opinion to be a manager, then they can problem solve within that container of the hour each week on how are they going to solve for it. So maybe that is hiring somebody or training somebody that they already have on the team. Maybe it's just being willing to let somebody else do it. Delegation is so hard for founders and for leaders. And on the flip side, it might just be that they want to acquire the tools. I would say within VetMed, when I'm working with people in true leadership roles, directors, executives, there is often a lack of experience with the management side, the HR side, the communications side, especially hard conversations with your team. So much harder for a lot of us than hard conversations with our clients. And so then we do get into they need those skills. They know that they need those skills on some level, and then we can kind of, work on the mechanics of it. I love that stuff. But again, I'm not going to come in and say, hey, look at you. You're really bad at XYZ. We're going to, start to apply this. There is remediation coaching where I'm hired because somebody's at risk of being terminated due to usually behavior, not necessarily performance, if that, distinction makes sense to our listeners. Really meaning somebody who's creating problems for the team, for the clients, what have you, as opposed to somebody who's not productive or doesn't, know how to diagnose or perform a surgery or what have you. Like that's what I'm distinguishing between behavior and performance. And that's a little bit different. And we have gotten like way into what is coaching, and we're not even talking about you.
Yeah. We can
So,
switch if you want.
Yeah.
It's fascinating to me. I have so many questions.
But mentorship, again, it can be coach adjacent. But I do think that people who really care about this, but have never seen themselves as a Mentor Vet has some training. And I think there's CE credit with it. And it's, just a few modules on communications and listening and, just pretty basic stuff. But I do think slowing down and thinking about how you want to show up for your mentee probably will make you a better mentor.
Yeah.
So let's talk about you as a founder, owner,
Well, yeah.
emergency vet.
Sure.
Addie and I started out talking about life outside of VetMed.
Yeah.
And I think that we have observed working with early career vets on up to ready to retire veterinarians that there are so many veterinarians who don't really place value or emphasis on creating a life or persona for themselves outside of VetMed.
Mm-hmm.
And there's so much talk in the well-being space about self-care and, all of the, pretty clear-cut things that we can do to take better care of ourselves. But I don't know how much we really talk about having an actual set-aside life outside of VetMed.
Mm-hmm.
And then you...
Like a dedicated, this is who I am inside versus outside the building. Or outside
maybe.
Space, yeah.
Maybe. Well, let's talk about it.
Sure.
You told me you don't really have a life outside of VetMed right now. Is that fair?
Yeah.
So this is topic 2. This is what I thought we were going to talk about today.
Yeah,
and we're like almost at time.
Bring it on. Yeah.
Do you think we should do a second episode?
Sure. We can do a third, fourth, fifth.
I listen. So for our listeners, I have already decided that Ben is going to be a recurring guest. So just, send us your questions for him. But no, I wanted to talk to you about how do you have a life outside of VetMed? When I think about our average listener who's driving to work and they're going to be, spending 10, 12 hours in the clinic, they may feel like they can't have a life, that they're working so hard to just, get their records done, get their clients communicated with, get home, eat a meal, get some sleep, and then go back to it. And Addie and I are at a different stage in our careers, and we've been there, don't get me wrong, but I think your experience right now is incredibly relatable. So in our next call, I want to talk about that. And then I do want to have a third call where we talk about this idea that maybe people don't want to work very hard anymore.
Oh,
Yes. My dog has just hopped into my lap. Addie and I talked about this on the podcast
Interesting.
yesterday. Yeah. And I think your perspective would be interesting on this one.
yeah.
So
I don't know.
let's
I certainly have thoughts about it.
let's pause there.
Okay.
And before we go, I feel like I should ask you something quippy. Recommend a favorite book for our readers.
Oh, wow. Okay. The Book Thief.
Oh,
Marcus Zusak.
fiction.
Fiction, yeah.
I love that.
So I was actually in a bookstore yesterday, which is I wish was a more regular part of my life. I read that years ago, and it's interesting. It's almost always the first book that comes to mind, because I read such a small amount of fiction.
Same.
Really,
Yes.
you
And
just kind of gravitate towards nonfiction, even if you're like I'm so interested in reading a good story, and then I pick up some sort of nonfiction, and that just is kind of what I end up learning. And sometimes I'm like, I just don't want to learn. I just want a story. And I don't know if it's like a daydreaming thing while I read or what, but
I think this is how we're going to start our next episode. I think this
Cool.
is relevant to your life outside of vet med.
okay.
All right.
That
I'll see you
sounds
next
great.
time.
Okay. See
Thank
ya.
you for joining us.
Thanks for having me.
Bye.
Bye.